Thanks for staying with us. So, COVID-19. The governor told us a couple of days ago that the isolation centers have increased from 1% to 6% in Lagos. That's quite scary. And we just read in the news this morning that Ibadan, Oyo State, actually recorded 2 deaths. They have 1 person who is in critical condition, and they've contact traced to find others who this person has been in contact with. That's for the Delta variant that everybody's talking about. I have Dr. Japheth on the phone. Good morning, Dr. Japheth.
Good morning.
Good to have you on. So,
yes, it's my pleasure to be with you.
This Delta variant, Dr. Japheth, what is happening now? I thought you guys got us covered. I thought you got the people covered, which that will feel good that there's no issue in Lagos State. What's happening?
Delta variant is going on in so many countries of the world now, over 19 countries of the world where they have the Delta variant. In fact, a handful of other countries have the Delta plus variant. So you cannot close the border for economic reasons. So people move up and down. When people move in and out, then they bring in the Delta variant. So I think what we should be looking at.
Can you remind us, what were the measures in place to make sure that those coming from these high-risk countries are isolated? Because it seems like government too relaxed on this issue.
The government recommends that people who want to come into Nigeria have a test done from wherever they're coming in. Now, when they get to Nigeria, they will also be put or be placed on self-quarantine for 7 days, after which they will do a test in Nigeria to confirm whether they are positive or negative, so that government can isolate them appropriately. Also, their details are meant to be dropped at the point of entry, so that health workers who are in charge of that can monitor them, can follow them up, can call them up to be sure they're not showing symptoms, to be sure that they are fine, or to be sure that they're actually obeying the self-quarantine rules. But what we have found out is that people were not obeying all these protocols. People were not carrying out the test when they get to Nigeria. People were not staying in self-quarantine for 7 days when they get into Nigeria. People were giving false addresses, false telephone contact when they get into Nigeria. So all these are some of the things that made us get to the point where we are now. Because the Delta variant was not manufactured in Nigeria. It was actually brought in, most likely, in my opinion, it was brought into the country. And it was brought in by people we call passengers of interest, POI, who arrive from destinations where this Delta variant is rampaging on.
Dr. Japheth, there are a few things we just would like for you to help us clarify, some myths. Many of us have gotten our vaccines. We're fully vaccinated. But we're hearing that, no, this particular one that you have, this specific one for Nigeria, it does not work against this Delta variant. That's one. Secondly, they say that the efficacy drops after a while. So even though you've taken it, after a while, you find yourself even more susceptible to this variant, like someone who's never had the vaccine before. I think there's one more. But those are the 2 I remember, yes.
Well, first of all, the vaccine is actually safe and important against the Delta variant or even the previous variant. So people who have had their shots are protected against the Delta variant. Now, the caveat is that people who have had their 2 shots may have the virus, but they will not develop the disease. They will not have a bad disease from the virus. So all this information, all those stories are unfounded. There's no medical research to support them.
So we have 2 questions on Facebook. First, Sakiboyewa is saying fully vaccinated people were among the deaths recorded in the UK. And the UK has largely completed vaccinations and is advising us to be careful, saying that the UK says they should expect 200 deaths daily. Then Andrew in StarTimes says that the Delta variant goes for young people below 20. Is this correct?
Well, there is a data that shows that 99.9% of those who have died from COVID-19 are those who have not received either one dose or two shots of any vaccine at all. So that speaks volume to the fact that the vaccine actually reduces the mobility and reduces mortality, reduces sickness from everything, mortality is death. So the vaccine reduces the number of people that die from the virus, the number of people that are being hospitalized from the virus. Yes, the Delta variant, we are not sure if they are more virulent in 20 or above 20. But we are sure that the Delta variant is more virulent than the previous variant.
Thank you, Dr. Jaffe. We have to wrap up with you now, but I think we'll be talking to you pretty often now that we have this condition, and we're going to keep getting updates from you. Thank you very much for joining us